Depression is a potential life-threatening disorder that affects hundreds of millions of people all over the world. It's really a tremendous cost to society as a disorder causes severe distress and disruption of life. And if left untreated, it can be fatal. Definition of depression. Depression is a symptom complex characterized by mood disturbance plus variety of cognitive, psychological, and vegetative disturbance. There are three main groups of cause deception. There are biological factor, social factor, and psychological factor. About biological factor, and genetic factor play a very important role in the development of major depression. 33 relatives of people with depression are more likely to have this disorder. Their high concordance with monozygotic twins. And it also found that allele of serotonin transporter brain is shorter than normal in people with depression. Other medical illnesses related to depression, such as Parkinson's disease, Alzheimer's disease, cancer, diabetes, or stroke. Vascular disease also a very important cause of depression. Chronic severe pain, prior history of depression, substance abuse also major cause of depression. But social factors, loneliness, isolation, recent bereavement, lack of a supportive social network, decreased mobility due to illness or loss of driving privilege, and psychological factor, traumatic experience, damage to body image, fear of death, frustration with memory loss, and road transitions are very psychological factors cause depression. About the pathophysiology of depression, the underlying pathophysiology of major depressive disorder has not been clearly defined. Current evidence points to a complex interaction between neurotransmitters availability and receptor regulation and sensitivity underlying the affected symptoms. And the decreased level or activity of central nervous system serotonin plays a very important factor. Other neurotransmitters implicated include norepinephrine, dopamine, glutamic, and brain-derived neurotrophic factor. And about the clinical feature of depression. Major depression must have five or more following symptoms have been present during the same 2 week period and represent a change from period functioning. At least one of the symptoms is either depressed mood or loss of interest or pleasure. And the six ECAPS is mnemonic for symptom criteria for major depression as a sleep disturbance, insomnia or hypersomnia, eye interest reduced, recur or self-blame, is energy loss, fatigue, C concentration problem, A appetite change, and P psychomotor change, S is suicidal thoughts. And so this is a very useful mnemonic to remember symptom criteria for major depression. We also have other kind of depression. Minor we also have other kind of depressions. Minor depression, also known as subsyndromal depression, subclinical depression, or mild depression, is associated with subsequent major depression, criticism of health service, reduced physical social functioning, or loss of quality of life. It, it is 2 to 4 times more common than major depression. Typical depression, which are different than the persistent technique of typical depression. If you have typical depression, a positive event can improve your mood. And patients with a typical depression often have somatic complaint, hyperphagia, hypersomnia, hypersensitivity to rejection, or heavy feeling in upper or lower extremity. And dysthymia is more chronic, lower intensity mood disorder. And by definition, symptoms must be present more than 2 years consecutively, and it is characterized by anhedonia, low self-esteem, or low energy. It may have more psychological than biological etiology. It tends to respond to medication and psychotherapy equally. And long-term psychotherapy is frequently able to bring about lasting change in this timid individual. Bipolar disorder. And people with this type illness trend back and forth between periods of depression and periods of mania, an extreme high. And it used to be called manic depression. Symptoms of mania may include less need for sleep, overconfidence, racing thoughts, reckless behavior, increased energy, and mood changes are usually gradual but can be sudden. Season affected disorder resulting from change in the season. Most cases begin in the fall or winter, or when there is a decrease in sunlight. Pattern of onset at the same time each year, and full remission occur at a characteristic time of year. Pseudodementia, zodiac syndrome of cognitive impairment that mimics dementia, but is actually depression. Poor attention and concentration. Symptoms result after depression is treated effectively. If considerable cognitive impairment remains, an underlying dementia is suspected, and even completely recover. Patients with this kind of depression have higher rates of dementia. And psychotic depression. And people with psychotic depression have symptoms of major depression along with psychotic symptoms such as hallucination, delusion, paranoia. And depression in elderly is not a normal part of aging. Subsyndromal depression increases the risk of developing depression, lead to early relapse and chronicity, often co-occurs with other serious illnesses, underdiagnosed and undertreated, and suicide rate in elderly are highest of any age group. Symptoms often minor, somatic complaints, persistent, vague, and plain physical complaint, agitation, anxiety, memory problems, social withdrawal, a high degree of suspicion. Specific inquiry is necessary for its detection and treatment. Depression associated with structural brain disease. 20% of patients with Alzheimer's disease have depression. And cerebrovascular disease also a major cause of depression. It's called vascular depression, anhedonia, executive dysfunction, and absence of guilt preoccupation, late age of onset, risk factor for vascular disease, and prefrontal or subcortical white matter hyperintensities on T2 weighted MRI. About the management, the treatment of depression. The treatment of depression can be divided into non-medical and medical treatment. And in 2011, the American Psychiatric Association (APA) updated its practice guideline for treatment of patients with major depressive disorder. It emphasized the need to individualize the treatment plan for each patient based on clinical assessment, presence of other disorders, stressors, patient preference, reaction to previous treatment, and the main aim of treatment improve mood and quality of life, reduce the risk of medical complication, improve compliance with an outcome of physical treatment, facilitate the appropriate use of healthcare resources, familiar with property and use of common antidepressant drugs, brief psychological treatment, and assessment of suicidal thinking and risk. The non-medical intervention, including balanced diet, fluid exercise, avoid alcohol, family support, social support, focus on positive, promote autonomy, promote creativity. Alternate therapy, including pet therapy, horticulture therapy, and pace appropriately. And patients of depression should be informed about depression and avoid stressors. Biomedical intervention include medication, psychotherapy, electroconvulsive therapy, vagus nerve stimulation, or combination of those therapies. Biomedication. There are some many kinds of drugs for treatment of depression, include serotonin drugs, norepinephrine, dopamine or dual mechanism. And about the treatment selection, we should use serotonin-rich drugs when patients have anxiety, irritated, hostile, or hypochondriac, and norepinephrine should not be used in elderly. Dopamine should be used in patients with the psychomotor symptom as retarded, blunted, apathetic, and with trust have two mechanisms should be used in melancholic patient, a typical depression, or patient have resistance to the treatment of so trust birth. And this is table of medication. This is a table of medications used for treatment of depression. The starting dose and therapeutic dose of them. And so here is special consideration in elderly. And in elderly, the treatment has to start slow and go slow. Dosage adjustment based on renal clearance, and as a right as used to at the same dose at adult, and response time in elderly is longer than in adult in younger, and because of higher risk of relapse in elderly, continue antidepressant for more than 2 years after remission of major depressive disorder. And all antidepressants are equally efficacious, and that are better tolerated than TCA, and that are related to side effects seen in elderly as pyramidal side effects, appetite, anorexia, Cyrus syndrome, upper GI bleeding. Psychotherapies is very helpful in mild to moderate depression, and response time is lower, relapse is less frequent, and is more effective than antidepressant in treating mood, suicidal ideation, and lack of interest, where antidepressants are more effective for appetite and sleep disturbances. Convulsive therapies indicate in failure of antidepressant trial, severe depression with catatonic or psychotic feature, high risk of suicide, poor to tolerability of oral medications, more efficacious antidepressant, but it contraindicated in ICP intracranial tumors. Side effects are short-term memory loss. Vagus nerve stimulation can apply electrical potency to the left vagus nerve in the neck for transmission the brain intermittently simulations about 30 seconds and then repeatedly after 5 minutes. The side effect patients often hear the hoarse voice, feel pain and tingling in the throat or neck, cough, headache, ear pain, difficulty sleeping, short need of break, or vomiting. And it is very important to evaluate the suicide rate. And such persons can very effective tune for tune and solve. And uh, 1 point for each positive answer. And from 0 to 2 points, it is no real problem. 3 to 4 points, patient can be sent home. And 5 to 6, it consider hospitalization. And 7 to 10 points, definitely hospitalization, involuntary or voluntary. That's the end. Thank you for your attention.